During his recent interview, Paul Thissen spoke about health care and GAMC specifically. The interview was done shortly before the announcement of the GAMC compromise between the legislature and the governor.
Paul, I'd like to ask you to describe your committee work in the legislature and the issues that you're particularly passionate about in that committee work.
Well, I chair the Health and Human Services Committee, so that's where I do a lot of my work. I also serve on Environment and Finance and Pension Commission. But on the healthcare area, the things I'm really concerned about, the things I'm very passionate about, first of all, children's health care coverage is something that I've been the leader in the legislature on, and we've actually made some really great progress on, even with this Just Say No governor that we have. I'm very concerned about making sure that we retain systems, programs for people with disabilities, services for people with disabilities, and do it in a way that continues this transition we've made for a generation to making sure that they can live more independent, dignified lives. And that should be our top commitment as a state. I'm also really concerned about the long-term care issues, how we're going to deal with the aging of our population. It is the long-term issue that we have to come to terms with as a state, and if we don't, we're going to be overwhelmed by this silver tsunami. And so those three areas are where I've been most passionate long-term and focused a lot. In the last 9 months, the biggest issue that we focused on is general assistance medical care and getting a fix to that.
Well, the big news in recent days is the failure, of course, of the House to override the governor's veto to extend the life of GAMC, yes. Who are the beneficiaries of GAMC?
Well, general assistance medical care is the care for the poorest, most vulnerable Minnesotans. So, there's 8,000 veterans a year that get served on that program. A lot of homeless people, a lot of people with mental illness and chemical addiction problems. These are people that in their current state, really can't get to work because they're living lives in crisis. These are folks making less than $700, living on less than $700 a month. So, when the governor vetoed that program back in last May, and then unallotted even more of it, I think he crossed a moral line, the worst thing that he's ever done. And people across the state have really risen up in response to that, saying this just is not Minnesota and we need a fix.
All right, there are two other subsidized medical assistance programs, Medicaid, of course, which is operated by the state but funded to a considerable extent by the feds, and Minnesota Care, which we'll discuss in a minute. Are any of the current GAMC beneficiaries eligible for Medicaid, and if so, why not?
They are not, because Medicaid only covers people either that are disabled or old, or if you're an adult with kids. They don't cover adults. It doesn't cover adults without kids, and so we don't get that federal match. The part of the health care reform bill would have moved us in that direction at the federal level, but obviously we haven't seen that come to fruition yet.
Okay. All right. The governor proposes to auto-enroll the GAMC people into Minnesota Care. First question is, does he have the legal authority to do that by himself?
Well, I don't think so. A lawsuit was just filed yesterday as we speak, challenging his authority to do that, and we have been saying that for several months. And it is because of the way our statutes is written and the way his veto works. As a matter of statutory authority, the authority to spend money in a particular program has to come from the legislature. This is a much bigger problem with this governor who thinks he can do everything without the legislature, but this is just one example of that.
So another example of unilateral Tim.
Yeah, being a dictator, or trying to be.
Second, following up on that, is rolling people into Minnesota Care a viable solution to the GAMC problem?
No, generally speaking. I think there are some people on that program who actually would fit well within Minnesota Care, and every proposal that we put on the table, including the one that was vetoed, acknowledged that fact and would have moved the right people into Minnesota Care. But for a lot of people on this program, it doesn't work. First of all, they don't have addresses where you can actually send the re-enrollment data. Secondly, they're people really living lives in crisis, thinking 1 or 2 days at a time, and Minnesota Care is an insurance program where you got to, fill out paperwork and keep it up. Also, more importantly for all of us and not just the individuals, Minnesota Care doesn't work for hospitals, because the difference between general assistance medical care and Minnesota Care is that general assistance medical care will pay from the moment of the visit. So if someone shows up in the emergency room, even if they're not on the program, if they later apply, the hospital can get retroactive payment. Under Minnesota Care, That's not the case. And so what the governor is proposing is terrible for all of our hospitals, because they're going to continue to incur this unfunded, uncompensated care. And ultimately, it's terrible for all of us, because what uncompensated care means is that all of our premiums go up.
Now, isn't the governor's plan just a transparent ruse to shed the state's obligation to take care of the GMAC people?
Well, I think it's two things. Yes, I think, first of all, it is. He doesn't have a commitment to making sure that we have a safety net for people, and he's proven that over and over again. The other thing it is he wants to take the money that we have dedicated for the last, well, nearly 20 years now in the Healthcare Access Fund. So these 2% provider tax that is on every visit to a doctor that we set aside to help working Minnesotans who don't have health care at their work. That's what that was intended to help, those people, and they really more and more need our help. He wants to take that and spend it on other stuff, and I think that has been a fight we've been fighting for a long time. That has been his goal since he's been the governor. It's absolutely the wrong direction to go. It's breaking a promise that we've made, and so you're hit the nail right on the head.
There is talk that this intended move, that is the move of the GMAC people to the Minnesota Care program, would bankrupt the fund. Where do we keep the Healthcare Access Fund?
Well, I mean, the Healthcare Access Fund is a separate set of dollars, an accounting set of dollars that's kept separate from our general fund, and it's supposed to be dedicated to a particular purpose. Governor Plenty, over the course of his 8 years, has borrowed hundreds and hundreds of millions of dollars, or taken hundreds and hundreds of million dollars, stolen in a sense, money from that fund that we could be using to fund Healthcare Access Fund projects, and put it into the general fund to spend on roads and all kinds of other stuff. Important things, but things that we should fund through the general fund. And so the reason that the Healthcare Access Fund is going into a deficit, and it's being accelerated by Governor Plenty's proposal to eliminate general assistance medical care, is because he has taken those funds and spent them for other things in a very irresponsible manner.
In order to keep his pledge not to raise taxes.
Exactly.
If you're a Hennepin County taxpayer, how does the elimination of GMAC likely affect you and provider institutions like HCMC?
Well, I mean, HCMC is the biggest provider of healthcare services to the general assistance medical care population. It is funded, if it's not funded by the state, if this money goes away, it's going to be funded by property taxpayers in Hennepin County in a very unfair manner, because Hennepin County Medical Center doesn't just serve residents of Hennepin County. It truly serves people from every single county in the state. It is the trauma hospital with Regions Hospital in St. Paul, where people go wherever they are in the state if they need the best, most complex emergency medical care.
You know, I noticed that the governor's proposed 20% cut in corporate income taxes is just about the same amount of money as the cost of the GAMC bill he vetoed. What do you think of that?
Well, I think it's a matter of mixed up priorities. And, the governor has been pushing on this corporate income tax reduction for a long time. If it was done in a responsible manner, we could have a discussion about it. But all he is about is cutting taxes and then cutting services to the people that most need it in his state. And it's really a reflection, this question that you ask is really a reflection of what we have to get after in this election. He is governed by this philosophy that we're all better off if just left to make it on our own, and those who make it, great. Those who don't, well, tough luck. What's made Minnesota successful for decades is the idea that we're actually all in this together, and that we owe some obligations to each other. So, his decision to focus on reducing taxes for corporations while he's kicking the most vulnerable, poorest people out to the street, it's terrible priorities. It's not Minnesota priorities, and we have to take it on directly in this election.